Hello, this is Peter Jermain. Today's August 14th, 2020. Here are the notes that I'll be using for this video. And the topic of today's discussion is going to be surface anatomy, which is the study of the externally visible features, anatomical features of the body. So in order to help me with this, I have asked for the assistance of Androniki.
Hello.
Who is my colleague, and she's also going to be acting as our anatomical model today. And I'm going to start by labeling 5 external features of anatomy on Androniki. So I'm going to start with the head and neck region. And first I'm going to call your attention to the auricle of the external ear, which you can see here. The connective tissue of the auricle is an elastic cartilage, which itself is a component of the skeletal system. And the auricle functions to direct sound waves into the external acoustic meatus. On the cheek, you can see the zygomatic bone here, which is also a component of the skeletal system. It is a facial bone that forms the cheek and also part of the lateral wall of the orbit. So now we're going to transition to the neck. So on Androniki's neck, I'm going to point out the thyroid cartilage, which you can see here. It is a hyaline cartilage structure with a laryngeal prominence, also known as the Adam's apple, which is a little bit of a misnomer because women also possess the laryngeal prominence of the thyroid cartilage, and the thyroid cartilage is a component of the skeletal system. So now we're going to transition to the forearm and the wrist. So here you can see on Androniki the tendon of the flexor carpi radialis muscle, which is a component of the muscular system. It's visible on the anterior surface of the forearm, proximal to the wrist, especially when the wrist is flexed, as you can see here. So if you look at the posterior surface of the forearm, you can see this large articular eminence, and this is the head of the ulna, which is a component of the skeletal system. It's a large articular eminence that's rounded in shape. So here, those were 5 external anatomical features, and the reason that surface anatomy is important is because gross physical examination remains a critical component of clinical assessments in the practice of medicine, ultimately because identification of surface anatomy can provide further information about the status of deeper body structures. So that's why surface anatomy is important. And to highlight 2 potential clinical applications of the features that we recognized, I'll start by listing one that's relevant to the thyroid cartilage. So there is a procedure known as cricothyroidotomy, where an incision is made through the skin and through the cricothyroid membrane in order to establish a patent airway in patients that are undergoing certain medical emergencies. And in order to correctly perform this procedure, the thyroid cartilage is a very important anatomical landmark for that. So the second clinical application has to do with the tendon of the flexor carpi radialis, which is an important clinical landmark for locating the radial artery and ultimately to determine the correct site for palpation of the radial pulse. So that's going to conclude this video today. I thank Androniki once again, and I thank you for your attention.